someone's injured, especially when they have nipples, do not panic like this.
Agay! Hello! Eto! Lano, na! Kaangal ko, luglo.
But instead, calm yourselves and follow the first 8 steps. But before that, let us know what severe bleeding is.
Severe bleeding are wounds that blood cannot stop pumping from the wound. If bleeding isn't controlled quickly, they may lose a lot of blood. It may also become unresponsive and possibly develop shock. Your number one priority is to stop bleeding.
Symptoms. Leading the following symptoms: fast heart rate, unconsciousness, and low blood pressure.
Here's some steps and advice to do when doing first aid.
Number 1.
There's a risk of infection, so wear protective first aid gloves to help prevent any infection passing between you both. Apply direct pressure to the wound using a sterile dressing if possible, or a clean and fluffy cloth to stop the bleeding.
If you're on your own, do not touch your wound and call for help. Number 2.
With open wounds, firmly secure the dressing or cloth with a bandage to maintain pressure on the wound. Make it firm enough to maintain pressure but not so tight that it restricts their circulation. Check their circulation beyond the bandage. Press one of the nails or the skin for 5 seconds until it turns pale, then release the pressure. If the color does not return, it means the bandage is too tight.
Number 3.
Keep monitoring their level of response until help arrives. If they become unresponsive at any point, prepare to start CPR. Always check or monitor the patient while there's still no help arrived. And if the patient do not respond to your questions, quickly do CPR. CPR can keep oxygen-rich blood flowing to the brain and other organs until emergency medical treatment can restore a typical heart rhythm.
Number 3.
If blood comes through the dressing or cloth, gently remove it and reapply pressure with a new dressing or pad to control the bleeding. Once the bleeding is under control, secure in the place with the bandage, tying the knot over the wound to keep the pressure on. Keep checking the circulation beyond the bandage every 10 minutes. Keep monitoring their level of response until help arrives.
When you have open wounds and feel dizziness, you can also do this.
A man was entering the room. The man kind of felt dizziness and hard to breathe. By the help of his tita, he elevated his feet and put a blanket to its stomach and leg. After that, she takes off the jacket so that he could breathe widely. And that's how you treat if you're facing that kind of circumstances.
That's all. Thank you for watching.